Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Abdullah Muhaimin bin Amrat, a candidate for Master Program in Emergency Medicine. My supervisor is Associate Professor Dr. Muhammad Johar bin Ja'far. Thank you so much for participating in the session today. In this fine day, I will deliver a presentation regarding phone referral using SBAR technique. Let me introduce to you regarding the phone referrals in our daily routine as a healthcare worker. Communication through phone is the most common way of communication among healthcare workers in Malaysia. Despite the advancement in technology, phone communication is still the primary and most accessible mode of communication in Malaysia. Phone communication is used to relay important information and bridging the information gaps in interspecialties management. Therefore, there is a need to properly communicate to ensure clear and concise information are relayed to the receiving party. We need to avoid what is known as information dump. Information dump is the act of mentioning all available information without sifting, selecting, and choosing crucial and relevant pieces to be conveyed to the receiver. Since phone calls are only comprised of voice, the receiver's attention span are limited and the ability to select and ensure only important and relevant information are conveyed is becoming more important than ever. Your graduation is soon. Congratulations on making it to the final year of your journey. Let's have a look at the internship program in Malaysia. When you graduated, you will become a house officer. It is a daunting yet purposeful part of your career. You are expected to do housekeeping works in the ward. Doing phone referral is one of the housekeeping works. Unfortunately, in Malaysia, there is no standardized phone referral protocols for house officers. This is a gap that needs to be addressed early in the undergraduate curriculum. Countries like America, United Kingdom, and Australia has made mastering phone referral technique as a compulsory learning outcome prior to the start of the internship program. In the first part of this presentation, we are going to explore on the construct and essential of SBAR. SBAR. S for situation, B for background, A for assessment, and R for recommendation. SBAR is an acronym used in the organization of information prior to a phone call. First coined by the United States Navy Submarine Division, it becomes a standard protocol for information relay during critical situations. SBAR allows complete information to be conveyed in an organized and concise manner. It requires the caller to sift and select relevant information according to a framework prior to a phone call. The versatility of the SBAR format has made it one of the most studied and adapted phone call framework for civilian usage, especially in medical field. So now let's imagine we would like to make a phone call. We will now explore the individual components of the SBAR framework. S in the SBAR stands for the situation. We start out the conversation with greetings and stating your name, position, and location. These three information are crucial to ensure you are not mistaken for someone else. As hospitals are a huge place with myriad departments, it is critical to introduce yourself with another identifier. For instance, hello, good morning. This is Muhaimin, a medical officer working in the yellow zone of the emergency department. As you can see from the construct of the sentence, besides your name, there are two more identifiers to help you to make a stronger impression to the call receiver. The next step is to confirm the identity of the receiver. You need to make sure you are speaking to the right person from the right department. Again, you need another identifier other than name, which is the position of the call receiver. Subsequently, we proceed with the identification of patient of interest. As with other identification, you need to state extra identifiers such as the registration number beside the patient's name. Finally, the most important part in situation is to state your clinical diagnosis or reason for referrals. This is the biggest paradigm shift for most interns and new graduates, as you are used to put diagnosis after a thorough history and physical examination. In phone referrals, however, we need to hook the attention of the receiver, and the fastest way to doing so is by stating the intention or clinical diagnosis early in the conversation. It helps in building a framework of understanding for the call receiver, as they now anticipate that all the information that are going to follow through will have to be tailored to the clinical diagnosis or reason for referral. Now we are finished with the S, the situation in SBAR. Let's move on to the B. B stands for background. Now that you have established all involved party and a clinical diagnosis or reason for the call, you will start to provide relevant background information to the receiver. It is easier for the receiver to understand and connect the dots once the reason for the call has been established early in the conversation. You will start with history of presenting illness and continue to the relevant medical history. All the relevant history now brings the patient to the current situation. Next, you provide the vitals on the first contact, followed by positive and relevant physical examination findings. In this section, or the background section, we are now building a profile based on the reason for the phone call. This is the same with the standard practice in presenting a clinical case. However, keep in mind that the clinical diagnoses are made clear early on. The continuation of information is now fluid and objective, as it is all tied up to the stated clinical diagnosis in the S part of the SBAR. Let's move on. Now we are in the A of the SBAR, which is the assessment. In the assessment part, you are now focusing on the crucial important clues that may help solidify your referrals. Here, you must mention important lab results and radiographic findings pertaining to your case. In addition, in this assessment part, you must also mention all treatments done to the patient and describe the response to the treatment initiated. This section helps to corroborate your story and help the receiver to further understand the referral. Now let's move on to the last section of SBAR, which is the R. R stands for the recommendation. This section is important to conclude and consolidate your phone referral. Up to this point, you have now presented all the available information for the patient. Now you need to request specific disposition and describe additional evaluation or treatment the patient will need. In this section, you may recommend or suggest beneficial intervention for the patient. If you call the surgical department, for instance, you may suggest an operation which you think necessary for your patient. If you call the blood bank, then you may suggest or request a blood products for the patient. There are no right or wrong recommendation in the phone referrals. The recommendation from you are a form of conclusion after all the relevant history, physical examination, and investigation done up to the point of the referral. A recommendation from you allow the call receiver to briefly outline the service required in the referral. You then close the conversation by clarifying any doubts and provide an extension number to be contacted. Now, you are finished and complete your SBAR format in your phone referral.